Again, for those of you who are take two for the ARPA meeting, for those of you that are seeing this on the town website, what have you, the town council is very excited to share the planning of the ARPA funds with you. We look forward to your input, and this is probably a once-in-a-lifetime opportunity for Wakefield to make some transformative changes in many areas, whether it's in programs or projects or what have you. So ARPA, or the American Rescue Plan Act, is a federal program. So it's all federal dollars that was signed into law on March 11th, 2021. And it's used for expenses incurred by Wakefield from March 3rd, 2021 forward. Okay, so we can't go backwards. You know, if we spent, $200,000 on masks that we're looking to get covered, back before March 3rd, 2021, we could not use these funds for that. Has to be expenditures going forward. The costs must be incurred or obligated by December 31st, 2024. And by incurred just means spent, and obligated means maybe we have a big project of redoing a park or something to have more outdoor activities. And we have the contract signed. We're not going to be quite finished by December 31st, 2024. That's okay, as long as the project was, was obligated and everything was signed. There's a little asterisk here that the funds should be received directly from the U.S. Treasury, and that is in the law, and I've read it, and it's, it's fairly thick when you go through the whole thing in the regs. I will tell you that has not been our experience. The funds go to the state and then are sent to the community of Wakefield. So that's a little bit of a misnomer there, and I get kind of a little kick out of it, so I thought I'd put it in there. Next slide, please. So what's Wakefield's share? Wakefield's share is a tad over $8 million. And the way that ARPA was set up, it comes under two categories. And remember, ARPA is a countrywide program. So in many parts of the country, there is a very robust county government, where your county government the county provides services, whether it's police or fire or ambulance services or anything else like that. That's the county. So we live in Middlesex County, and Middlesex County really, other than having a probate court and a registry of deeds, really doesn't provide those services directly to the town of Wakefield. So part of our share is what would have gone to the county had the county be active. So we get the county share, our portion of the county share, and we get our town share. And this is really all done on a per capita basis. To date, we have received half of these funds, so roughly $4 million. Other than the amounts that we talked about at town meeting, which is about $500,000 or so in actual salaries that we talked about, the rest is held in a separate ARPA account. It does not count towards our free cash or any of our reserves, but it is available. Next slide, please. So whenever you get government funding, they certainly have some, they have some strings attached. So ARPA needs to be spent on 5 broad areas, and they're here. Public health spending, I think that's pretty self-explanatory. The economic impacts of the public health emergency, and we'll talk about that. We'll talk about all of these further. Lost public sector revenue, premium pay for essential workers, and water, sewer, and broadband infrastructure projects. This is what the House and Senate voted on and was signed into law by President Biden for ARPA funding. Next slide, please. So let's talk about public health spending, okay? Certainly COVID-19 mitigation efforts, whether that's contact tracing, vaccination clinics, testing clinics, things like that, that makes a lot of sense. Other medical expenses that may be incurred in the department, mask dissemination that we did before, things like that. A key area of this, I think, is behavioral health. There are lots of issues that outside of the actual virus, the physical virus, is behavioral health. We're seeing a lot of anxiety. We're seeing behavioral health in schools among the public, maybe areas we want to look at in the public health area. And also covered in this is health and safety personnel, whether we have, people going out, our police, fire, social workers, people that we have in place going out, things like that. Contact tracing, tracing down all of the people that have come down with the coronavirus would be it too. Next slide, please. Economic impacts of the public health emergency, the second area, okay? The federal government further breaks this down into mitigating the economic harm to workers. Think about people that lost their jobs, couldn't work during this time. Households suffered greatly. Small businesses, a lot of small businesses are still struggling, and we've been working with them. Nonprofits that couldn't get their money to get things going, and also education. Huge issue of learning loss in this area. Next slide, please. Okay. Slide number 3 is really not that exciting, and we're not going to talk about this area tonight, really. But ARPA funds can be used to replace revenue reductions. And frankly, Wakefield did okay, actually better than we thought through the whole pandemic. However, there is a kind of long, convoluted formula that the federal government has stated that, you can kind of look at how much you were getting in certain things like new growth and other revenues, your entire revenue stream before the pandemic, and then you multiply that by a factor, and then you look what you actually got, and could be there some money there that would just say, hey, Wakefield lost $1 million in revenue. We're going to take $1 million out of ARPA funds and put that right in our general fund to replenish that. That is something we could look at. I frankly would wondering, we put the formula, is there a lot there for us? If we did do that and went into the general fund, still could be used, but if it's in the general fund, it's subject to a lot of different, it has to go through the budget process and town meeting. So we're not going to talk about that tonight. We're really going to talk about exciting things, but this is one of the 5 areas that you can look at when you apply for ARPA funds. Item number, next slide, please. Item number 4 is premium pay for essential workers. This can be critical infrastructure of personnel during the pandemic, overtime costs. It could be premium pay for people in the private sector. The state actually is using some of their ARPA funds to send the state money to people that worked in some of the private sector jobs, whether it be groceries, things like that, grocery clerks, things like that. We have not determined to look at this yet. I will tell you that we did use some FEMA money during the pandemic to pay for overtime for police and fire, because when I had half the staff out with COVID and we had to pay overtime, that was not in the budget. So we did use some FEMA funds for this. Premium pay for essential workers is not as exciting as the other things we're going to talk about tonight, but it is in the mix. Next slide, please. Water, sewer, and broadband infrastructure. And again, think about that this ARPA is again a nationwide issue, and a lot of areas of the country do not have clean water access. We're very lucky in Wakefield. We do have clean water access. So we probably don't have a lot of projects there, but we can look at that when we think outside of the box a little bit about maybe that helps economic growth by, increasing water pressure and water availability. Wastewater, again, we are pretty good here in Wakefield going through the MWRA. We have a good sewage system. Other areas of country don't. I think stormwater is something we could certainly look at, drainage issues and how that affects, viability going down the road. Broadband access, there may be some areas where we need to increase our broadband access to help the business community and people learning at home and working from home. But again, Wakefield's much better than a lot of the country is. Cybersecurity is another area we could look at, and maybe we will. This is one of the areas that we're going to talk about as we go forward. Next slide, please. So what we're going to do is we're going to have 3 breakout sessions. And in a couple of minutes, Sherry is going to put a third of you into a breakout session, and you will have a facilitator and we will all discuss in the breakout sessions the same issues. We'll all discuss at first public health spending. And then we'll come back and we will kind of jot down everybody's idea, and then we'll move forward. Then we'll go back out to the second breakout session, where we'll all discuss the economic impacts of the public health emergency. Then we'll come back, talk about that. And then we'll go out for the third, which is water, sewer, and broadband infrastructure. I felt that these were the most exciting ones. I don't think we want to talk about a boring revenue formula. And I know the public doesn't want to talk about bonuses for town workers, so we weren't going to get into that. So when you do go out to the breakout sessions, they will be handled by our three facilitators, and our three facilitators tonight are Jen McDonald, our communications director, Erin Kakinda, our economic and community development director, and Victor Santinello, our assessor. And they are there to help move the conversation along. Next slide, please. So I'm asking you to be bold and think outside the box here. I said, this is, again, I think, a once in a lifetime chance. So when you think about what these could be used for, when you look at your different areas, think about, in supporting the economic impact of the coronavirus. Think about how maybe supporting to enhance outdoor spaces works into that. Restaurant patios, improvements to the built environment neighborhoods, facade improvements, connectivity of sidewalks. Think about how that may help there. Sidewalk connections. One thing that is specifically talked about in the federal guidelines are investments in parks, public plazas, and other outdoor recreation spaces. It really promotes healthier living for people to get outside. And think about during the early days of this in 2020, when we really had people continually walking around the lake and still using some of those outdoor areas. It's healthier. It doesn't cost a lot of money, so it's a real equity. It's equitable. So think about that. Sidewalk connections I talked about. Think about how we help the businesses out of this. Digital marketing and job training. We've done a few seminars on digital marketing. It's kind of changed, right? The way we market and we talk to people. Job training. Some people are going to have to be retrained, especially our youth, to get jobs and what have you. And the other one is expansion of health services. Think about what our health department should be. They really slogged through this tough time here. But a health department is not only about fighting a specific virus, okay? It's also about what else happened. And what really was highlighted during this time is how people have been affected. Anxiety levels are higher. People are depressed. People aren't socializing. These are areas that we really may want to look into a much more robust health services to talk about that. One thing that is not really highlighted on the list here, and I think it does work in, because I think there are a lot of educational issues, learning loss and things like that. That kind of works into all of these items here today. There isn't a separate section for that. And the reason for that is that when we are dealing with the federal government, one thing we have to make sure we do is that we look at all different buckets of money. And there are other buckets of money that specifically handle education. It goes by the acronym ESSER, E-S-S-E-R. And we got a lot of money last year out of that separate federal account. So I'm not talking about education, because we should talk about this, but I'd like to get 8 million on ARPA and then 4 million on ESSER, so we hit all of that. So I'm not sliding it, but we certainly should talk about it. But there are other areas to look at it. I wanted to make that clear. So I think right now, be bold. We're going to put everybody into their first session, and that is going to be about public health spending. And think about that as maybe what we want our health department to look like over the next decade or two, and services they could look at. So we'll come back in 10 minutes if we do this right, and then we'll talk about it at the end. Okay? Pressure's on to see if we can do this.
Okay, so I think you all are assigned. I'm going to open up the rooms and then you should be able to go into them. It looks like people are moving.
Oh, good.
Okay, so then, yeah,
Okay.
we got to
I was going to say, I didn't get a request for one.
Nope,
So
you came in a little late, so I'm going to
Yeah.
get you in there, Nicole. Hold
Hi,
on.
Nicole, how are you?
thank you. Hi, good. How are you?
You good?
All right, so, and I got to do Ian also, so bear with me. Let's see. Okay, let's see. Nicole, you're gonna go to. All right, Nicole, you should be all set.
Got it. Thank you.
All right, you're welcome. And Ian, let's see, we're gonna put you. Okay. All right, so did Ian go over? Yeah, okay. So Steve, I'm going to
Wow.
okay. Everybody's back.
Okay. All right. Everybody's back. It worked.
Okay.
Well, great. Thank you very much. And we're going to start with Victor, and Victor can share with us some of the ideas that came up with in his session.
Well, I want to thank everyone that attended room two. Room two rocks. Let's see. Most of the feedback we got and input we had from the folks were concerning, health issues. A big issue that popped up was substance abuse. Helping people, because through the pandemic, I don't know about you folks, having an extra glass of wine every other day or 3 extra every night, can become an issue. Also, a social worker, perhaps better partnership between the Board of Health and the police department, along with helping to identify mental health issues and facilitate referrals. A suggestion was made to maybe expand the Board of Health and try to advertise and get out there with more local clinics for all types of vaccinations. And we discussed the role of school resource officers. And, is that something that perhaps could be expanded and maybe brought into some type of public health type of thing, maybe in concert with social workers or what have you?
Great. Thank you very much. We'll go to Jen. How did your group do?
Our group was amazing. So we started talking about mental health, and there was a great suggestion to have maybe some office space for drop-in mental health services, specifically for students who probably find it really awkward to be pulled out of class. Then everybody knows, we know that they're leaving, or, it's just not the right time when they're in school to go and seek those services. That could also, be something that could be offered to other residents as well for these drop-in services, maybe certain, maybe students on certain days, that kind of thing. Then we kind of switched gears and started talking about the outdoor spaces. Looking into safe, well-lit spaces for relaxation, contemplation, where it's in a visible enough area where you feel safe and it's well lit, but it is not necessarily that you're just sitting on a bench on Main Street. And then we had a lot of discussion around the lake. A lot of folks really loved walking, realized how nice it is. It's also great for mental health, but as great as the lake is, the sidewalks are quite narrow, especially if you have a stroller, a dog, or both. And another thing that came up was maybe some pop-up areas to allow us to experience outdoor fun in the winter. And it kind of went back to the Vision 2030, if anybody was in that in those sessions of where an idea was to leave a legacy area, an idea of amphitheater, ice rink, those all kind of came up. So
Great. Wonderful. And our third group, Erin.
I'll be the last one, the greatest. So mental health was a big thing we talked about. I think we cannot ignore that. Behavioral health will always be a thing now, especially with kids, adults and, seniors. So we need to figure that out. Housing in town also was a big thing. Just how we address that with people and moving forward. And then seniors with mental health. They're very lonely. They can't see many people. How do we address that? And yeah, living here is a health emergency. How do we keep living here and address that? So those are my notes. Veterans too were part of my notes. So
What was the last thing?
veterans.
Veterans, okay.
So sorry, I was trying to jot. I think Jen and Victor are definitely better at me keeping notes, but yeah, I think it's definitely an issue we have to public health in general.
Great. Those are all great suggestions, and that's what we wanted to get everyone's input. All right, you guys did such a good job. We're gonna go back out into our rooms, and we're gonna talk about the economic impacts of the public health emergency. I will tell you that I attended a webinar that the state put on, and they basically said almost anything's going to go under this category. Well, I don't particularly like to live that vicariously, but my charge to you all is to be bold and think way outside the box here. There's a lot of things we can do to improve the economic climate for everybody. So we're going to pop you back out for 10 minutes and bring you back in. Thank you.
Hi, Erin.
Hi, Erin.
Oh, you're muted, sweetie.
Where is everybody?
Yeah.
Breakout rooms will close in 36 seconds. So how did you get out so early?
I don't know.
I don't know either, but welcome. Yeah,
Oh, they're popping in now.
they're popping.
Hey there.
Hi, Ann. How are you?
Hey, Ann.
I'm good. I'm traveling and then I'm going to go pick up my baby from the airport.
Oh,
Oh, lucky you.
I know. So I'm going to jump off, but I want to put money into cleaning. How about Lake Quannapowitt? Can't we do that?
I
Outdoor
think,
space?
yeah, I think you can make a case for that. Absolutely.
I
Yeah.
think we can. All right. That's my thought. Now I'm going to go get my baby. Thank you.
Okay.
I will watch the rest.
All right, thanks,
Okay.
Ann.
All right. Bye.
Bye.
All right. Great. Well, technology is a great thing. Seems to be working. So great job. I'm sure we got some really cool thoughts here on this subject. So, Erin, why don't we start with your group this time?
Economic childcare is a huge part of this. Being a working mom or dad or whatever, just trying to provide for your kids is definitely difficult. If there's any way childcare people can get any sort of funding, a community center downtown where people can come. Maybe we can have a co-working space. And then my notes kind of went off. Just I was part of the conversation. So those are my big things. But if anyone else in my group has anything to add, Ryan, Jonathan.
I was going to say the other two things I think we touched on were transportation, both in terms of making sure, thinking about sort of sidewalks and accessibility so that people can get to public transportation, but also thinking about if there's a way to kind of connect other parts of town to access to public transportation through either a public-private partnership in town or even kind of a regional effort with, Stoneham and Reading and Melrose and other communities. And then we also talked about, facade and building improvements in some of our commercial areas.
Great, thank you.
Eva, I had also asked if this was a category from people who were struggling and they're in arrears with their taxes, water bills, utility bills, if this was the category.
I would say it is, yeah. Yep. Okay. Public assistance.
Yes.
Okay, great. All right, Jen.
Sure. So to bounce off of that last point, we also talked about making sure that folks, especially essential workers who have had to work through the entire pandemic, are receiving, an appropriate income, and if they're struggling, that perhaps there is a way that they can get assistance. We talked a lot about outdoor facades, outdoor dining, adds a lot of vibrancy, and helping businesses make facade improvements to make the downtown a little bit more cohesive and more updated. We also talked about potentially collaborating and combining efforts with other groups, like a Main Streets or groups in other communities, groups that are already supporting businesses. And then one interesting idea that came up was, it's not one I'm familiar with, but the SDM Foundation that's in Melrose was started by a philanthropy endeavor, I'm thinking, to do workforce training. And something that came up during the pandemic is that those who are not tech savvy really had a hard time because everything was online, whether you wanted to buy things or attend some of our meetings like this one now. So we do have, the vocational and high school, our assets for tech training, and maybe look into helping those folks as well.
Great, excellent suggestions. Victor.
Well, our group, Room 2 rules again. We talked about outdoor seating. A lot of good things came of that and proved to be a necessity and a hit. We talked about maybe, trying some ideas to make it look better, better than just a, barrier there or what have you. I mean, we've seen some things where kids get out there and cover them nice, but something, perhaps a little bit more inviting. We talked about, perhaps when things lift, various street closures like we used to do for the various town events that we had in the area. Maybe we can make that a recurring thing once a month and see what kind of draw that is to help businesses. We also talked about, in the vein of outdoor seating, outdoor heating, to perhaps, expand the outdoor seating, maybe get a few more weeks out of it. Although today would have been a bad day to sit outside if it wasn't, misty out temperature wise. And also we discussed perhaps making funding available to assist small business owners with ventilation inside their places for the winter. Having proper ventilation might also be a critical component that goes hand in hand with public health. So, and better signage, in addition to, the overall walkability of the town, making things, Jen has done a lot of great work with the signage that is started, and maybe a continuation upon that, maybe more frequent or what have you.
Okay, great. All wonderful suggestions. All right, our last category, water, sewer, and broadband infrastructure. And we're going to pop you out and then come back in for some final words. So keep up the good work and keep brainstorming. And Sherry will pop you out
Yep.
right now.
Yep, there are. It should be happening.
Victor, you didn't have the best group this time.
Okay.
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 Maybe.
Yeah. All right. We're going to start with Jen. It's Jen's turn to start.
All right, so we talked a lot about the water quality of the lake. And also we talked about stormwater. So, you know, we're getting a lot more intense storms where there are inches of rain coming down in a very short period of time. So there's a lot of flooding going on. And what can we do about the flooding? Can we install more rain gardens, tree wells, creative ways to mitigate some of the stormwater runoff in addition to the ones that we have? Other ideas, you know, these are small ones. People love the Rainbow program. How can we maybe expand that to businesses? Are there any other incentives that we can give to residents to help with the stormwater runoff we have from these intense storms?
Excellent. Great comments. Erin.
Pause, sorry. Fiber connections through town are not great. If there's any way we could like kind of have like mini parklets to have free Wi-Fi or fiber connections. Drainage was also brought up as well. Just it's not the greatest. Clean out our ditches. So we've had issues there. But yeah, I'll go along with Jen. I think we talked about that as well. But I think the big thing we talked about was like IT, Wi-Fi, and fiber connections.
Okay. Victor, last but not least.
Well, we talked about making sure we have safe drinking water from Crystal Lake. We talked about maybe creating a fund to assist folks with replacing lead service into their homes. Perhaps any necessary updates to water treatment plants around the town and pumping stations. Talked about, as Jen's group did, about diverting runoff, be it, you know, barrels or other creative ways to get involved with that. Cleaning of culverts. This is where areas where the DPW really just doesn't have either the authority or the ability to get to them. These areas where, you know, streams and things occur, they back up and flood people's homes. They can flood neighborhoods, things of that nature. Maybe some expenditure there, some regular type of cleaning service to help with those. Suggestions made about a water tower to ensure, you know, should anything happen, we, you know, have potable water available. And a great idea for a one-time disbursement, perhaps, you know, sensors hooked up to the internet that will test our water for us and provide live results straight to the folks at the water department, and perhaps other strategically placed centers at problem sewer junctions, things of that nature, so that the town might be alerted earlier of a pending issue rather than responding to, you know, an issue that already occurred.
Great. Thank you. Thank you very much. Before we do wrap this up, a couple of things. In the chat, there is a reference to a guide that you can click on to look at that has some more resources here. Please feel free to do that. Number one. Number two, there are a couple of town councilors on that have stayed with us, and I want to give them an opportunity maybe to you know, greet everybody and say hello if they wish. And I'll start with you, Ed, if you want to say a couple of words. And Ed and Jonathan, be brief.
As always, Steve, right?
As always, yes.
Hi, everyone. I'm Ed Dombrowski. I'm one of your town councilors. I really appreciate the feedback that I was able to hear from my group and everyone, you know, at large. I will say that a number of things that came up tonight, the town council has spoken about in the past, which I think is encouraging. I think it shows that we're all aligned with our priorities by and large. And so thank you for coming out tonight. This is the beginning of a much you know, longer dialogue that we'll be having. So again, thank you. And I wish everyone a Merry Christmas, Happy Holidays, and Happy New Year. Thanks.
Thank you, Ed. Jonathan?
I'll be very brief, and just to say, again, thank you for everyone for participating. I find these discussions really energizing, and the ideas that are generated to be really exciting. I've talked about the ARPA funds and other forums as an opportunity for us almost to think about sort of some generational projects for the town. And, some of the ideas we talked through definitely fall into that bucket, and also fall into the bucket of things that really improve the quality of life for folks here. So thank you for everyone. Look forward to more of these discussions and seeing this all come together in a positive way for Wakefield.
Thank you, Jonathan. And before we close up, I am very honored that we have a Stoneham Select Board member joining us tonight. So Ramey Parker from Stoneham, she wants to see what a real town is like. No, we love you over there. Did you want to say a few words, Ramey? Just to say hello.
Yes, Ramey Parker, Select Board in Stoneham, and I love to not recreate the wheel, so I will listen to my colleagues and our neighbors and take all these ideas back to Stoneham. So thank you for having me.
Thank you so much. Thank you so much. And good luck with the high school project. We're thrilled for you. We're thrilled for you.
I'm sorry, if I could just mention, Ramey, since you're here, I wanted to again say it was so great to see you at the Dodging for Dollars competition that we had between Wakefield and Stoneham for the Boys and Girls Club.
I tell you, I've never participated and I won't. I'd like to write a check.
Smart.
Thank you. If we could put up, so what's going to happen with this? We're going to take all of the ideas back. We're going to talk about them, with the council. But there are other opportunities for people that could not be here tonight. I know it's busy. You get busy in life, and something happens, and all of a sudden, this hour-and-a-half window is gone. So keep your eye up for a survey. Which is wakefield.me.us/ARPA. We're going to put all these together to kind of see where the rest of the community is on these, and a spot, I think, Jen, where people can put in other ideas, right? We're always available to hear them. You can pop that back down. So that'll be up on the website soon. So I want to thank you all and wish you all a wonderful Christmas, Happy New Year. We're kind of slogging through this again. I kind of feel like, geez, we're back to where we were before with this pandemic, but I think we're smarter. We're vaccinated. We have some tools. We know what to do. And I think we just need to continue that and stay strong. Just so you know, our team is always available to hear any of your concerns or your suggestions as we go forward and make Wakefield and our neighbors like Stoneham a much better place for everybody. So I thank you all and have a great night. And whatever we can do for you, please contact us. Thank you.
Thank you. Win two rules. Yay. Good night.
Good night.
Thanks, everyone.